I'm Matilde Laura. I am a consultant neurologist and honorary associate professor at Center for Neuromuscular Diseases, the National Hospital for Neurology and Neurosurgery in London. And my field of expertise is the Charcot-Marie-Tooth disease, and I do specialist clinics on Charcot-Marie-Tooth disease. I learned CMT because as part of my training, I started working in neuromuscular diseases and peripheral neuropathies. And then I did a PhD, and I came to London as part of my PhD, where I started working with Professor Mary Riley, which is an international expert on Charcot-Marie-Tooth disease. And this is where I learned about the condition in depth. I also worked in Italy with Davide Parison, who is also an expert on Charcot-Marie-Tooth disease. So I have now worked on Charcot-Marie-Tooth disease for a long time. Charcot-Marie-Tooth disease, or CMT, is an inherited neuropathy, which it's a length-dependent inherited neuropathy, also known as hereditary motor sensory neuropathy. And this affects the peripheral nerves, the motor, and the sensory nerves. CMT causes distal weakness and distal sensory loss. It is a very slowly progressive condition and is caused by mutation in a number of genes. And up to now, we know of more than 100 genes associated with the CMT. First of all, I think it is important. The clinical history is extremely important, as well as the clinical examination, the family history, and then also the diagnostic tools, which are the neurophysiology, which is important as it will define what type of Charcot-Marie-Tooth disease the patient has. As we know that there are two main subgroups, they are called CMT1, or demyelinating, and CMT2, or axonal. I think the important thing for other professionals is in the clinical history. So asking questions to patients, such as how long have you had the symptoms for, asking about questions on the first decade of life, as this condition usually starts in the first 2 decades of life. And I think it's important also to put some emphasis on whether the patient had any difficulties with doing sports or running fast or having difficulties fitting shoes in the first decade of life. The family history is extremely important, as this is an hereditary neuropathy. So sometimes, most of the time, patients can have a family history, so other family members affected. And this really helps with the diagnosis of CMT. And then is the examination. So I think the examination is mainly to explore the weakness in the distal part of the lower and the upper limbs, usually with the weakness of ankle dorsiflexion, difficulty standing on the heels, the absence of the reflex or reduced reflex, the presence of foot deformities, which is also another clinical features, and also the sensory examination, because with sensory loss, like the pinprick or the vibration loss in the distal part of the lower and upper limbs. I think also for other professionals, when do you suspect CMT is when there is a long-standing, very slow progression course of the symptoms. They usually start early on, and sometimes patients, they don't realize, and you need to really ask specific questions about their childhood or early adulthood. Sometimes it is difficult to diagnose CMT because some patients may have very mild phenotype, may have very mild symptoms. They sometimes feel that it's normal for them to have weak ankles or to have tendency to trip or tendency to fall. So again, the history is extremely important. Most of the time, patients report having difficulties walking or balance difficulties since early on. Usually, like in the first decade of life, as I said before, they report not being good at sports, not being fast at races, having difficulties wearing high heels, for example, having some difficulties writing for a long time, for example, at school, when the hands were getting tired after writing for a long time. And also, they report sometimes having high arches, tendency to walk on the outer part of the feet, that their ankles were rolling over. Also, they report symptoms that started in the first 2 decades of life. They progress quite slowly over the years. They usually report mainly around the feet and ankles, hands. Sometimes they have scoliosis, or they had also surgery performed very early on. So sometimes the patients, they are not firstly referred to a neurologist, but they can be referred either to the physiotherapist or to the orthopedic surgeons because of the feet deformities. And then they have surgery, and then they are referred to the neurologist. Of course, neurologists, rehabilitation medicine doctors, very important in talking about CMT. But don't forget, there are also other health professionals. They are really important in the management of the CMT. And therefore, I think they are important also. They are important figures that they can talk, and they can talk in details about CMT. And these are physiotherapists, the neurological physiotherapists, podiatrists, occupational therapists, orthotists. So I think all these health professionals have an important role in CMT, as well as orthopedic surgeons. Orthopedic surgeons sometimes are the first health professionals to see the patient with CMT because they are, for example, referred firstly to them, and then they refer the patient to the neurologist. I would say, first of all, stay active. We know that, exercise and being active is really important in CMT. Seek help when you need and talk to other people, health professionals, but also other people with the same condition, because this is also quite important for patients. I would like also to highlight the importance of multidisciplinary approach for CMT. So not only the neurologist be involved, also the physiotherapist, the occupational therapist, the orthotist, the nurses, the podiatrist. So my message is, although CMT is a rare condition, and although at the moment there is no cure for CMT, there are many aspects that need to be considered for patients with CMT, and they can be helped and supported. And therefore, I think it is important to refer patients to experts for a multidisciplinary approach. The diagnosis in terms of, first of all, as I said, the history taken, the examination, the family history are extremely important. Also, they are extremely important, the neurophysiology, and then the genetic testing to reach a genetic diagnosis. In terms of management, the management is based mainly on symptomatic management. So it tends to address the symptoms, which can be like pain due to the food deformities, using the use of orthosis, so in-source ankle braces to address, for example, the foot drop or the weakness in the lower limbs. The occupational therapist that could help also to manage the hand function, the difficulties with the hands. Podiatrist, as foot care management is very important in patients with CMT. Yes, I mean, research in CMT is very important. As I said, it is important to treat the symptoms, manage the condition, but also research as an important part in this. As we know that with research, we have the advances as led us to identify a number, and high number of genes causing the disease, which is very important. There is quite a lot of research taking place to understand the mechanism on how these specific gene defects can cause the disease. But also, there are quite a lot of research going on in terms of trying to finding a cure for CMT, mainly probably to reduce the progression of CMT. The research is also focused on finding exploring outcome measures, so tools that can be used to assess the progression of the disease, but also that can measure in a sensitive way the progression of the disease. And this is extremely important as CMT is a very slowly progressive condition. And therefore, outcome measures are important tools for clinical trials when we test new compounds and new drugs. Also, there is quite a lot of research also taking place in finding biomarkers for this condition.